Issue on the African scene, the politics of succession in Africa, and the crisis of stability and power. How critical is this?
Police arrested 4 people for the violence in Johannesburg, while 8 others were arrested.
All right, with now over 2,400 cases, confirmed cases of COVID-19 on the African continent, debunking the claim that Africa might be largely immune, Africa's leaders face a huge challenge right now to curb the spread of the virus, especially with widespread poverty in place. What are the challenges faced at this time in a bid to stop the spread of COVID-19 on the African continent? Join us after the break for all the facts and the sides on the agenda.
Why we're here, it's about these 3 things. We're here because of the man. We're here because of the message. We're here because of the mandate.
Who is the man, Jesus Christ? What is your conviction about his personality and purpose?
Once these 3 factors are clear to you, you'll be unshakable.
As you listen to this outstanding 3-series DVD, The Man, The Message, and The Mandate, your journey of life will become even more glorious.
What you have to do now is to live for Jesus. You can't live for yourself anymore. If you truly love Jesus, then you must live for him.
This DVD by Pastor Chris is available now. To order, please call the number now showing on your screen. Experience the liquid love of our Lord Jesus Christ flow in and through you. It's also available on the Pastor Chris Digital Library app on the Google Play Store and Apple Store.
All right, once again, I want to thank you for joining me on the agenda. On today's edition, we'll look at the spread of COVID-19, also known the coronavirus, on the African continent, which many analysts some weeks back thought was widely unscathed by this dreaded virus. But recent developments have actually made us see otherwise. Well, joining me before I introduce my guests, I'd like to remind you that you can watch us on the go at our website at www.loveworldplus.tv, and you can go to any of the online stores to download our app, which is Love World Plus. All right, my name is Henry Williams once more, and I'd like to say thank you for joining me. And I have on the show today my colleague and correspondent on Love World Plus. His name is Marshall Anthony Onoye. Marshall, great to have you join us.
Good to be here, Henry, on the agenda.
Great to see you. As you can see, well, we do not have a guest in-house, but we'll be linking up with a guest. His name is Dikpo Oyewole via Skype, and he's also will be sharing his own insights on the current development. To set the ball rolling, take you to this sort of incidents report, which takes a look at developments on the continent based on the spread of coronavirus as of the 19th of March. And after that situation report, we'll be back in the studio. Let's go there and we'll be right back. More than 600 cases of COVID-19 have been confirmed in 34 countries in Africa as of the 19th of March, compared with 147 cases 1 week ago. Although the region has seen a significant increase in confirmed cases recently, thus debunking earlier insinuations by analysts that it was largely immune due to its tropical weather. There are still fewer cases than in other parts of the world. The Gambia became the 31st infected, reporting a case on March 17 of a national returning from the United Kingdom. Djibouti also reported a case on the 18th involving a Spanish national on a military assignment. Zambia's coronavirus cases have risen to 12 from 3. Mauritius reported its first case on Wednesday, the 18th of March, becoming the 34th infected African country. Chad reported the first case Thursday, the 19th, becoming the 35th infected nation. Niger, via a tweet by President Issoufou, also reported their index case on Thursday, March the 19th, becoming the 36th infected nation. Its neighbor and Africa's most populous nation, Nigeria, has recorded 51 cases. Cape Verde government reported recently that a British national had tested positive, becoming its index patient. Zimbabwe late Friday confirmed its index case, becoming 38th infected country and 5th in the southern African region. Uganda, Eritrea, Angola, and Madagascar recorded index cases on Saturday, March the 21st. Mozambique confirmed index case on March 22, becoming its 43rd infected nation. There are now more than 1,400 confirmed cases of coronavirus across the continent, with a number of African countries imposing a range of prevention and containment measures against the spread of the pandemic. According to the latest data of the WHO on COVID-19 in Africa, the breakdown remains fluid as countries confirm cases as and when. The whole of Africa has rising cases, with a sizable number of countries holding out. All right, situation report there. Diverse, reports coming in. The numbers keep changing by the second, Marshal, we must confess. Trying to track the number of those affected, it has become much of a challenge, especially when data is not compliance to data. Finding accurate data in Africa is a big, big issue.
Well, for Center for Disease Control, it's been more of, they've been relying on confirmation.
Confirmation, yeah, confirmed cases.
Testing hasn't been frequent in, this side of the world. But South Africa has been very, very frequent with testing. But in other climes, you find them having testing at different levels. You have drive-through testing. You have confirmation and data updated from time to time. On the go, every minute you find data being updated. We currently have over 100,000, over 100,000, far beyond 100,000, because you still got
in Africa, right?
No,
okay.
not in Africa.
Okay, all over the world.
Yes,
okay,
all over the world. So that's not to say that there's some kind of respite for Africans. Yes, you're focusing on the gist or the story that Africa was immune.
Yeah, that was the idea we entertained, hopefully, and in the earlier stages of this virus, when it hits the other parts of the world.
Well, it's good that we'll finally come to know that that's not true. The story about Africans being black skin or black colored and having the melanin beyond that, which is found elsewhere in the world, the melanin seem to be resistant to the virus and all of that. Well, now we know it's not true. Now we know it's a hoax. Yes, because of the temperature in some parts.
we prided ourselves in our climates, thinking that it would actually slow down the virus. Have we seen much of?
Yes,
have
it
you seen
has.
that
I would
happen?
say yes, it
Okay.
has. It's the climate has been, especially in sub-Saharan Africa, has been largely hugely responsible for the slow growth or the slow spread of the virus. However, that's not to say that the virus cannot spread. Remember that it is not all, the temperature is not evenly distributed. You still have to get into your house. You still have, some people are still letting visitors in, hosting social gatherings, and these are places where the temperature might not be as evenly distributed as outside or external beyond the confines of your home. So you'd find that the virus will thrive. And once it's latched on its host, it will equally, begin to wreak havoc on its host. And another thing again, when they say that the temperature in the sub-Saharan Africa might affect the spread, doesn't necessarily mean that when you lose guard on social gathering or social distancing, that the weather will come into play and kill the virus before it's transmitted from one person to the other. No, once you have someone who is infected emitting that virus, either by the residue of the what's it called now? Residue from the breath, or residue from the spittle from the mouth, and it rests on the person's face and gets to locate the mucous membrane either from the eye, nose, or the mouth. The virus takes its host immediately.
Takes effect.
There is nothing that the weather has to do with that at that moment.
One thing we've seen leaders in Africa grappling with the peculiar environment we find ourselves to actually impose lockdowns. And one nation that has become the epicenter of this virus in Africa is South Africa. And remind you, it might not be because they have more cases, but as Marshall has cited, they've been able to test more. And we've seen President of South Africa, Cyril Ramaphosa, coming out to make a speech. Let's take that speech, and we will be bringing Dikpo Oyiwole, who's standing by, joining us from Lagos, Southwest Nigeria.
We've decided to take urgent and drastic measures to manage the disease, protect the people of our country, and to reduce the impact of the virus on our society and on our economy. We have now declared a national state of disaster in terms of the Disaster Management Act.
All right, just one of the nations there to impose a lockdown. Some are actually bringing out the cavalry, the military, to help enforce, because we have a peculiar environment. At this juncture, I'd like to bring in Dikpo. I'm sure he has a lot to say about this matter. He's been at the forefront and in trying to make government see how much the responsibility they have to do in making sure that this situation doesn't hit the people too hard. Dikpo, are you with us? All right, well, when Dikpo comes on board, we'll bring him into the discussion. But Marshall, you can see right now with lockdown being imposed by different countries, even Nigeria now, we've seen lockdowns. The challenge of how to keep people indoors is a reality, especially with, the widespread poverty. The likes of Africa's biggest economy, Nigeria, being the poverty capital of the world. This also poses a challenge where you have no social security nets for people.
Henry, I did mention that earlier in a different program, but just to give you an insight of what can be done. A whole lot of people are donating and giving free will donations in terms of funds to cushion the economic effects. We've got several members of the private sector coming to donate their goodwill in terms of cash and resources and materials. We have the richest man whom I called out earlier on.
Aliko Dangote.
Yes, Aliko Dangote, the richest man in Africa, as it were, donating 200 million, which, as much as that is commendable, I still say isn't enough.
He can do more.
You know, he can do more. We've got in the international scene the likes of Messi and Pep Guardiola. But here it is, Henry. 40 million Nigerians have BVN, verified by banks.
Okay.
And it will cost the federal government 100 billion naira to pay 250,000 naira into each account so Nigerians can buy food for
To cost them
themselves.
how much?
100 billion.
naira.
100 billion. So Nigerians can buy food for themselves and their families during the coronavirus lockdown. If Nigeria can budget 150 billion for National Assembly of less than 500 legislators, 150 billion budgeting for them, 500 legislators. The question here people are asking, why can't 100 billion be budgeted for the 40 billion people that
actually have data that you can verify?
Yes.
But that's a good question, and this is a good time to bring Dikpo in. Dikpo, I hope you've been following the discussion.
Yes, I have.
What are your thoughts, especially with the lockdown and the peculiar environment you find ourselves? The challenge of widespread poverty poses a major issue when you talk about lockdown, social distancing, and isolation.
Okay, well, for me, I see it as a major challenge because I've had a few conversations with a lot of people, and I'm sure you've seen some videos on social media where people don't believe that the coronavirus exists. Some believe it's for rich people. Some believe it doesn't affect us Africans. Some believe Nigerians are immune to it. Some believe it's for a certain group of people. So that is where we found ourselves in terms of where illiteracy has come to play. Also, there's a poverty angle to it, which is sort of making the lockdown suggestions a bit difficult because, as we know, there are a lot of people who fall within the economic gap that they need to make a daily living so that their family can feed. So that is where the challenge is. But yes, what your guest said in the studio, I caught on right when he was doing his analysis. It is quite apt, and I think it is left to the government to say that if they have the economic will, which we do have anyway, if they have the political will to get it done, they will get it done. Because in Kenya, it was just recently announced that the president and the members of his cabinet and other key government officials took an 80% pay cut so that they could fund they could get the resources to fund the coronavirus epidemic out of their country. Now, that is a government of people that we are seeing that are making tangible moves to see that resources are put in place to ensure that things are being done. So I think it's for the Nigerian government.
The CBN has floated a fund.
Genuine political will.
The CBN has floated a fund to cater for businesses, and that will be affected, you know, by this virus spread. A 50 billion naira fund, which also has also called for all the private stakeholders can actually increase that fund. Isn't that enough?
Well, it will make a dent, but the truth is the bulk of people that will be really affected by this aren't your typical business owners that have the CAC registrations, that the CBN will be able to verify their corporate account details with your bank and all of that. It's the people on the streets, the people in the markets, the people with the shops, okay, that do not have CAC registrations. So the question is, they also fall within the bracket of small businesses. How are they catered for in that budget? All right, so that is where I'm having the challenge of reconciling what they're saying and the practicality of it. It is a fantastic idea, don't get me wrong, it is a fantastic idea. But in terms of coverage and in terms of it being effective, how have they been able to get the data of those businesses that they want to say will be partakers of that fund? So that is the angle I'm looking at it from, the angle of efficiency.
Let's remember we had that the WHO and the World Economic Forum had online press briefing today. Quite interesting and illuminating, with some insights brought to bear. Dr. Michido Moeti, World Health Organization Regional Director for Africa, pointed out some things which I'd like us to look at. We talked about the issue of diagnosis as testing very critical to curbing this virus, and the challenge we have with facilities is undeniable. One of the things pointed out is paying attention to small countries too, who don't have the wherewithal to actually, because fighting this virus is clearly very expensive, isn't it?
Yeah. Yes, it is. It is really expensive. And yes, of course, we need to concentrate on the smaller countries and see how nations of the world and private sector can also render aid to them. But I would also say that we look back at home here and see how we can make the most of the resources we have. A few days ago, the governor of the Lagos State and the Commissioner for Health, they had a press briefing, I think it was 2 days ago, and the Commissioner for Health said they were putting together 2 more centers, 2 more testing centers, to ensure that they had a wider network of the tests being carried out. I think they currently have, the current capacity is 50 tests per day, and the other 2 centers will bring the daily testing to between 120 to 150. So for a population of that we have in Nigeria, and of course the population we have in Lagos State, is that enough? That isn't enough. But is it somewhere to start from? Yes, it's somewhere to start from. But I think that they need to do a lot more. They need to do a lot more, because I mean, we keep seeing rapid cases and rapid numbers coming up on a daily basis. We had a bit of good news a few hours ago saying that 6 confirmed patients were going to be discharged today. We don't know if they've been discharged yet, but we got confirmed reports that said that we're going to be discharged. So I mean, we're making progress. But the question is, are we getting enough people in there to ensure that the testing is being done when it should be done before the cases go quite critical? We've heard 1 or 2 reports of people saying that they called the NCDC, they didn't get to them on time, and then the case got critical, and then the person passed. We had 1 or 2 of those. But the question is, how efficient is the system? Are we able to get ahead of it by saying we have a huge number of testing facilities, as well as having a huge number of isolation facilities? So I think that is one thing we need to look at critically. Also not neglecting the smaller nations. That's why we said that if nations of the world and private sector can put heads together and see how they can render aid to them, because either we like it or not, they are still part of the human race and they are our neighbors.
All right, I'd like to bring Marshall in to this discussion at this juncture. Before I do so, I want to take this clip. It's talking about enforcement as well. Kenya police enforcing coronavirus restrictions on transports and markets, something we've seen in these climes as well. What are the challenges? Do they have to use force? But let's see this and we'll be right back.
Kenya police fired tear gas to bring an end to the activities of local matatu drivers. It is feared that the use of these minibuses will help spread the coronavirus infection. They are also stopping markets from taking place and telling traders to stay at home.
The directive was that all the markets should be closed, and that's why we are here. We are mobilizing. We want all the traders to go and sit home because of this coronavirus. It's a deadly disease.
The area governor last week banned all official market days to contain the spread of coronavirus. Kenya has recorded 28 COVID-19 cases so far, with 1 recovery and 0 fatality as of March 25. Kenyan President Uhuru Kenyatta also announced on Wednesday Kenya will impose a countrywide curfew effective Friday evening as part of measures aimed at curbing the spread of the virus.
All right, Marshall, looking at that report, undeniably there are challenges in enforcing social distancing and self-isolation. What are your thoughts on this?
So people still do not understand the severity of this case. When you walk around the streets with a nose mask or hand gloves on,
you're looked at as a clown or something.
You're looked at as somebody who's weird, or you're even looked at as the coronavirus itself, you know. And then you're now asked to, there's that issue, people not understanding the severity. There is also the issue of poverty, which you had highlighted earlier, Henry.
Yeah.
These people are majorly people who fend for their daily bread on a daily basis.
There are no social security nets for these people.
You do understand.
They are not captured.
Clearly. So, irrespective for us, South Africa has imposed the 26 days.
26 days, I
yes,
think.
26 days.
21
lockdown.
days. 21 days.
Okay, 21 days lockdown. Good to know. Good to know. And we hope that, you know, we do know that something good
because the numbers are racing.
Yes. We are bracing up right now. The military has been called in to get ready. There are projections that maybe by Monday there will be a complete lockdown for Nigeria. We do not know. The Lagos State government has come out to say, look, there won't be a total lockdown. They are putting markets, emergency markets in place. They are using school properties and all of that to ensure that people will not have to go long distance to, you know, get their daily consumables. But the question still remains, how empowered financially are these people to get, you know, their daily consumables?
How empowered. And, you know, recently we heard lawmakers ruminating on the idea of actually looking at prisoners with not so serious cases and setting them free. But one country that has moved in that direction is Ethiopia. It's freed over 4,000 prisoners. Ethiopia has announced it will free inmates from the country's overcrowded prisons, something that we also face in this part of the world. Let's take that report, and we're going to Dikpo when we return.
Ethiopia has announced it will free thousands of inmates from the country's overcrowded prisons as part of efforts to curb the spread of the new coronavirus. Attorney General Adanet Abebe told state media the measure would apply to more than 4,000 prisoners, many of whom are locked up for petty crimes and drug offenses or have less than a year remaining on their sentences. Conditions in Ethiopia's prisons are harsh, in some cases life-threatening, marred by gross overcrowding and inadequate food, water, sanitation and medical care, according to the latest annual human rights report on Ethiopia from the U.S. State Department. As of Tuesday evening, Ethiopia had confirmed 12 cases of COVID-19 after conducting 480 laboratory tests. Officials say all the cases involve people who traveled from abroad or had direct contact with people who traveled from abroad. Prime Minister Abiy Ahmed appeals for Ethiopians to practice social distancing have fallen on deaf ears as large crowds continue to gather in Addis Ababa for religious ceremonies and other events.
All right, great to have you back. And you saw that report, Ethiopia doing what it has to do.
Focusing on the concerns of people not abiding or on with the regulations that the government has put in place. Social gathering, you know, seem to be the major concern. I want to say that when you showed us the video of Kenyan authorities trying to enforce forcefully the regulations.
That wasn't nice. That wasn't nice. Let me bring in Dikpo.
Okay.
Dikpo, are you with us? Yeah,
yes,
you've privy to what we've seen. Two of the clips. One talking about enforcement, which was forceful, something very common in African climes. And the other one talking about the strategies actually to deal with this issue. One of them is space, accommodation, okay, for those affected, which we really don't have. What are your thoughts on this?
Okay, well, first I'll start from the enforcement, which is the second part of it that has been a bit chilling for me to think about, aside from the fact that a lot of families aren't economically empowered to survive a lockdown. Now, the other side of it is the enforcement, like we're talking about. And I mean, there were reports of 2 people being shot in Rwanda. for violating the lockdown. I mean, so for me, that's a bit extreme, and I'm sure the report you saw some people being flogged and all of that. So for us, the question is, how do we expect the government to go about the enforcement? Okay, is it violently? Is it non-violently? If it's going to be non-violently, what measures are going to be put in place? Are we going to have people arrested? Is it just going to be tear gassing them or sending them packing, or because you should understand that a clime like Nigeria, and especially in Lagos, where we have these all sorts of task forces, okay, probably like a dozen of them. I'm sure I exaggerated that number, but we have a lot of them, and we're on the risk of a lot of them having to exploit this time to say that, you know what, we're a task force, you're not supposed to have any selling going on here. We come in, we confiscate all your goods. So the question is, after confiscating their goods, what happens afterwards? Okay, do they get it back? So for me, the question around enforcement is something that honestly I haven't been able to get a solution around, and I'm hoping to see how the government will go about the enforcement, because it is very important that we get it enforced, because like we've stated earlier, a lot of people don't believe that they can be affected by the coronavirus, and that from those people, we run the risk of having a high number of people being affected by the virus and then spreading it around among the populace. So for me, that is quite unacceptable.
Okay, talking about, some people believing they are not, they can be affected. They cannot afford not to believe that they are affected. And one of those people living in those areas are the people living in riverine areas of Amakoko, where filth is, they're submerged in filth, and they've come to, I think their immunity has, over the years, come to reach its, its peak, that they feel invincible, to what is happening. But is that the truth? Let's take this report where Makoko and the realities there are brought to bear, and I will be back in the studio.
Concerns mount for the welfare of a vulnerable Nigerian community over the spread of the coronavirus. The Makoko neighborhood is home to tens of thousands of people living in steel shanties built along the Lagos Lagoon. Inhabitants here have been warned by the government and community leaders on good hygienic practices. However, some are adamant that the waterways are safe.
Concerning the coronavirus, we were told to wash our hands very well before eating. There is no disease in the streams of Makoko. We have been living here for a very long time. I was born here and there is no disease here.
Look at my compound. My children have been awake since 6 a.m. to clean up the surroundings, and that is how it is across the floating community. And we have been informing people that after using the washroom to wash their hands thoroughly clean before going to eat, because of what is happening now, we are very scared.
Nigeria announced its first case of COVID-19 3 weeks ago. Since then, the total number of cases has shot up to 22.
So recently, the total number of cases has hit over 50, and Makoko there brings to bear a reality. Ironically, how do you isolate such people? How do you preserve such people? We are indicted, Marshall, because we have looked the other way over the years, and now the hen has come to roost, where we must put our house in order if we are to pose a legitimate fight against, the spread of this, coronavirus.
It will be an uphill task, Henry. I would honestly subscribe to the call for a total lockdown and an enforcement, whether forceful or otherwise, of that lockdown. Like you've seen in the riverine of Lagos or the riverine of the Southwest, the Makoko community, these people are, they act as if they are not part of this world. Yeah. They are oblivious of what is happening, and even when you try to, educate them on it, they boastfully would tell you that they're rising above that. because they've seen worse
situations, and you know the survival instincts within them, since they seem to be seen as the scum of the earth, and government really doesn't think that, you know, people should live in better conditions.
These are people living in the midst of their feces. I mean, they excrete where they feed, and then you begin to wonder, why are they not infested with Lassa fever? Because you have all kinds of rodents and rats, you know, roaming around that community. You have all kinds of reptiles in the filthy water. You have mosquitoes. These are people that have been exposed to malaria, and you're wondering why they're not coming down in their numbers with malaria. You know,
I mean, it's amazing that these people survive these harsh conditions.
So they will be the last people to listen to you when you go telling them about coronavirus.
Well, as the time winds down, I'd like to bring in Dikpo on this matter. Big concern we have here, Dikpo, looking at these people, the lifestyle they live, filth is commonplace, and these are one of the things we must deal with in the fight against the spread of this virus, isn't it?
Yes, it is. And I think the time has come for us to have a realistic conversation about their existence in the Makoko community. Because, I mean, God forbid, we have a few cases amongst them. It will be very brutal. I won't mince words in saying it will be very brutal, it will be very lethal. So that's why I said, God forbid. And like we've earlier stated, that somehow they have, I think they've been able to overstate their immune systems because of, like you said, I mean, they've lived in that kind of environment for decades. Some people were born there, some people grow up there, they get married there, and then they stay there. I mean, you and I wouldn't last there for 2 hours without coming down with malaria. But somehow their immune system has been able to rise above that. But that being said, the human immune system, because you are immune to one thing doesn't mean you're immune to all things. Okay, that isn't how the immune system works. Okay, the fact that you can be immune to malaria doesn't mean you can't come down with a common cold. Okay, which the coronavirus is more an advanced version of the flu, if we're putting it mildly. So I think it is time for the government to have a critical conversation, and us as a people to have a critical conversation about these people and the entire community. Because if there is an outbreak in that community, they will be forced to come on land. And then the question is, where do they go from there? Is there going to be a spread? Is there going to be a huge pandemic caused from that community? We really can't say. And I would say that the possibilities of things that could go wrong, they're quite frightening, and I would rather not think about it. But I think the time has come for us to have a critical conversation around the existence and sustainability of such an environment in the 21st century.
Well, Dick, I want to thank you for joining us on the show. It's been great having your insights, you know, quite enriching to the discussion. Dikpo Oyewole there, reaching us from Lagos, southwest Nigeria. All right.
Thank you, Dikpo, and be sure to observe your social distancing and proper personal hygiene.
Yeah, just like we're observing in the studio right now, aren't we? We're compliant like that on the agenda. Well, looking at the figures now, as we said earlier, numbers matter. Africa's virus-free countries have reduced from 11 to 8. We have Lesotho, Comoros, Sierra Leone, South Sudan, Burundi, Botswana, Sao Tome and Principe, and Malawi. And we have in the African region, statistics differ. European Union says over 2,000 confirmed cases. And some figures say 1,000 plus cases. Marshall, what are your thoughts talking about the issues of social environment here? Some people don't even have pipe-borne water to start with. How do they wash their hands? You know, we must face the realities that over the years, the lack of social infrastructure that should have been put in place, there's really nothing right now to fall back on, is there? And yes, at times like this, we always call on God, and He does answer.
Henry, the fright is the Western world. If it took them I mean, Donald Trump, the president of America, is projecting by Easter to be out of the waters of coronavirus and to begin to see the numbers go down. China currently is already celebrating. We have the Chinese economy already booming. We have the markets opening already. We have Wuhan public spaces being, people returning to public spaces. I mean, it took them this 2-3 months or 4 to get out of it. And then America is saying, look, in 4 months, moving into the second quarter of the year, we would be out of this. The question you want to ask yourself, these are places where social amenities, infrastructure, where the hospitals, I mean, China built a hospital in how many days?
In 3 weeks.
In just, well, less than 3 weeks.
It says
2
3
weeks.
weeks. Okay, 2 weeks.
You know, and then here we are at this juncture, we have a National Assembly that is trying to propose that the government sets up a hospital in 6 months. In 6 months. So what you're trying to tell you is, we are going to build this hospital in 6 months. And in that 6 months, we are thinking or assuming that you will still be, or we will still be in this crisis. Okay. So getting out of it will be beyond 6 months. So people are already projecting, say, fourth quarter of the year, December, while the United States is saying Easter. Nigeria is saying, well, we're going to build a hospital in 6 months, and then before we talk about coming out of it. So my thoughts are, as little as what is necessary to be done, and inexpensive it is, social distancing, hand washing, sanitize when you can't have access to water or soap, stay at home when it's not necessary. If the government has to do a lockdown, so be it. Let us have that lockdown, and let's see the cases that have not been accounted for or not confirmed. Let those cases come and pass, you know.
We have something of an interest talking about water, having available water. Some communities, Tanzania, for example, the people have resorted to ingenious ways of trying to, you know, take care of themselves. This amateur video I'd like to show you before we wind down actually tells a story. Can we take a look at this amateur video, and we will be here with you.
The need to have running water there.
That is what we face. That's what we face.
And then you saw the soap, the locally made improvised soap dispenser there. But you know, the challenge with that woman's running water is that it's running. You see part of it running on her feet as well. You know, so leaving residue of the virus. Peradventure, if she had the virus on her hand and washing it off, you have the residue on her feet, and you don't know where those feet would get to. Probably would end up in her bed at the end of the day, and hope that she doesn't get her face or her head around the area of the sheets where the virus residue would leave.
Well, I did read one of the tweets by former minister in Nigeria, Bring Back Our Girls convener, Ezekwesili. And she says, talking about the monies needed to build this necessary infrastructure, we don't need to look too far. As you cited, our senators and our lawmakers, what they earn, if they can set aside some of that for this, I think with the issue of cash shouldn't be a problem. But as we wind down, Marshall, what are your thoughts before we go, and any suggestions for government and stakeholders in talking about this issue?
The government should wake up on this, especially talking about Nigeria. They should wake up on this. They should not make this a political thing. Jack Ma donated relief materials and some testing equipment, medical equipment, and to think that they had to bring them into Lagos and then had to get them to Abuja, as if to say someone needs to see them before they get redistributed. Lagos is the state with the highest number of these infected cases. Why did they have to take the entire cargo to Abuja for redistribution again to Lagos and other parts of... So I see the unseriousness, I see the they don't understand, a lack of understanding of the severity of the case and what the government needs to do. I still also clamor for a total lockdown.
All right, I hope you heard what Marshall said. He's clamoring for a total lockdown. And at this juncture, maybe I'd like to bring Dikbo in once more, since he's still around, to say his final words. Dikbo, any takes before we go?
Yes, I mean, like Marshall rightly said, we're not seeing a huge sense of urgency with the government in responding to this virus, but I hope that we see them to be a lot more responsive in the few days to come. And yes, I'm also in support of the lockdown, because when we have the lockdown, we have sort of a control group, and then we know the people who are currently infected with the virus, and we get to treat them, or we get to isolate them, or we get to identify them, and then we keep every other person safe, because we really do not have all the resources needed to handle a massive outbreak on our hands. So the government, they really need to be up and doing, and they need to be very responsive with regards to COVID-19.
All right, no additions there to what Dikbo has said. Well, one thing is certain, WHO head says Africa must wake up to the coronavirus threat and prepare for the worst, according to Director General of the World Health Organization. It says the continent should learn from how the spread of the virus has sped up elsewhere. And his name is Tedros Adhanom Ghebreyesus. I will leave you with his soundbites. My name is Henry Williams, and I want to thank Marshall. Thank you very much for coming on the agenda. It's been great having you. Marshall anchors program News Focus on Love World Plus. And yes, we've observed social distancing on the show. And thank you very much once more, Dikbo, who actually joined us via Skype. We'll leave you with the soundbite from WHO Chief Edram Ghebreyesus on this matter. Remember, you can watch us on the go at www.loveworldplus.tv or download our app from any of the online stores, and it's Love World Plus. Do remember that only Africans can build Africa. God bless you.
To slow the spread of COVID-19, many countries have contributed unprecedented measures at significant social and economic cost. Asking people to stay at home and shutting down population movement is buying time and reducing the pressure on health systems. But on their own, these measures will not extinguish epidemics. Aggressive measures to find, isolate, test, treat, and trace are not only the best and fastest way out of extreme social and economic restrictions, they are also the best way to prevent them. We call on all countries who have introduced so-called lockdown measures to use this time to attack the virus.
Issue on the African scene, the politics of succession in Africa, the crisis of stability and power. How critical is this?
Police arrested 44 people for the violence in Johannesburg, while 8 others were arrested.